Is an antibiotic for sinusitis commonly referred to as sinusitis a necessity or a mistake that could lead to complications? Sinusitis in children is a separate topic for discussion because children have their own peculiarities of the development of the paranasal sinuses, peculiarities of the course of the inflammatory process, peculiarities of functioning and the nose, and so on. And we will dedicate a separate special issue to this. Today we will talk about sinusitis, that is sinusitis in children and adults, when you are prescribed antibiotics from the first day of diagnosis. Children up to age 7 are frequently diagnosed with sinusitis due to extended runny noses. That is, a long-term nasal congestion, discharge from the nose, a feeling of fullness in the throat, cough. And doctors think that we have a prolonged runny nose and prescribe a sinus X-ray to rule out sinusitis. With a pronounced runny nose, the nasal sinus's mucous membrane swells. This is often misinterpreted as sinusitis, and antibacterial drugs are prescribed based on outdated standards. We have several nasal sinuses. These are the maxillary sinuses, frontal sinus, small sinuses and cells deep inside, and the main sphenoid sinus. And depending on the inflammatory process, its location, the disease can be called sinusitis, frontal sinusitis, ethmoiditis, sphenoiditis. For simplicity, today I will use the general term sinusitis. This is an inflammation of the nasal sinuses. Most often, sinusitis develops against the background of a severe respiratory viral infection in most cases. In some cases, the mucous membrane may overproduce mucus in response to the virus. Or, as a rule, there is a predisposition to this or such an infection. A pronounced swelling develops, as a result of which the sinuses windows through which the sinuses communicate with the nasal cavity are closed. A secondary swelling develops in the sinuses and symptoms begin. This is a heaviness in the area of the forehead, in the area of the upper jaw sinuses. There may be a feeling of distension in the area of the bridge of the nose. There may be abundant discharge from the nose and a feeling of stuffiness in the throat and other complaints at which the doctor will prescribe you a sinus X-ray, will see their swelling, will diagnose sinusitis, and will prescribe an antibiotic. But I remind you again, in most cases the disease begins against the background of acute respiratory viral infection, and as is known, antibiotics do not affect viruses. Antibiotics are frequently overprescribed to children under 7 with nasal congestion and thick nasal discharge. Such a child is prescribed a sinus X-ray, although the listed complaints are not an indication for a sinus X-ray. And naturally they get a sinus shadow. The radiologist notes sinusitis signs. Sinusitis for some ear, nose and throat. Doctors, why is that? It's a red flag for which he should prescribe an antibiotic. Of course, there might be some effect that an antibacterial drug has, because against the background of microbial decay, it becomes slightly more. As a result of prescribing an antibiotic, the antibacterial load, or rather the antigenic load, begins to decrease slightly and becomes easier. But we remember that our own natural flora is also being affected. And as a rule, these are often sick children. And we are reducing the number of beneficial microbes that protect the child from pathogenic flora and reduce the likelihood of severe respiratory viral infection. But even the antibiotic, it does not provide a sufficient effect. That is, the problem still persists. Sometimes they prescribe a second or even a third antibiotic. Until the child's immune system has dealt with this problem on its own, they, excuse the expression, are tortured with antibacterial drugs. Sadly, that's how things are. In children, especially those up to 7 years old, a persistent runny nose is often associated with enlarged adenoids in the throat interfering with normal nasal passage function. Therefore, first of all, if a child under 7 has a persistent runny nose, you need to diagnose the throat, check the condition of the adenoids. They are probably enlarged, interfering with the normal functioning of the nose, and all this leads to the fact that, of course, the mucous membrane swells, the nasal cavity is congested, but this does not require separate treatment. You need to treat the primary situation, the adenoids themselves and the nasal cavity itself, and in most cases it does not require antibacterial treatment. But indeed, in some cases, an antibiotic is needed when there is a real bacterial inflammatory process. This could be a primary bacterial infection, such as pneumococcus, or it could be bacterial complications against the background of acute respiratory viral infection, which usually occur on average on the 5th to 7th day of the disease. Now, I will tell you about the indications for prescribing an antibiotic so that you know in which cases the antibiotic will really be beneficial and not harmful, and in which cases there are really indications for taking an antibacterial drug. The first indication we will talk about now is purulent discharge from the nose. But as for any of the indications that will sound further and about purulent discharges from the nose, all this should be against the background of other symptoms of sinusitis. That is, it is usually a feeling of heaviness spreading behind the cheeks, a feeling of heaviness or pain in the area of the eyebrows, a feeling of spreading in the area of the nasal bridge, a pronounced swelling of the nasal mucosa, headaches, a confirmed diagnosis on X-ray. And besides these symptoms, if there are purulent discharges from the nose, that is yellow-green, then this is an indication for prescribing an antibiotic. Only together with other symptoms of sinusitis, and especially with the pain syndrome. The next indication is a high body temperature above 38 degrees, 38.5, 39.40 against the background. Other symptoms of sinusitis, especially if this temperature is poorly reduced and requires the use of antipyretic drugs more than 3 times a day. I have already told you that the pain syndrome in the face area is an indication for prescribing antibiotics in the complex, but I will stop separately on this symptom because, as a rule, it is one of the key criteria for prescribing antibacterial treatment. This is pain in the area, the cheek, pain in the area of the upper sinuses usually, or headaches of a diffuse nature, which can be, for example, with sphenoiditis, an inflammatory process in the main sinus. The next indication is the ineffectiveness of complex treatment methods for sinusitis. That is, if we do everything necessary, remove the swelling, wash out the mucus, and observe other principles of sinusitis treatment, and within, for example, 3 to 5 days we see absolutely no effect, or this effect is insignificant, then in such a case it probably also makes sense to think about prescribing an antibiotic. The next symptom is signs of a bacterial inflammatory process, even a purulent inflammatory process, as a result of a general blood test with a formula and an erythrocyte sedimentation rate. What do we see? As a rule, in adults, these are figures above 12,000 leukocytes per liter. In children, these are figures that can exceed 14, 15, 16,000 leukocytes at 10, 9 degrees per liter, and such an expressed leukocytosis is a sign of a bacterial and purulent and inflammatory process and, accordingly, an indication for the prescription of an antibacterial drug. In addition to everything else, we look at the blood formula, the ratio of neutrophils to the percentage content of lymphocytes. That is, if we see that there are far more neutrophils than leukocytes, this is a sign of such a bacterial immune response. And if, for example, we see on the contrary a large number of lymphocytes with a low number of neutrophils, this can indicate that either the process has gone into a recovery stage and antibodies are being formed to the infection that the child or adult has overcome, or it is and a sign of the presence of an inflammatory process against the background of a viral infection. Unfortunately, there are cases when even we, doctors, doubt whether the child needs an antibiotic or not when the symptoms are vague. That is, they seem to be there, but they seem to be insignificant. And in such cases, we rely on the data of additional research methods, in particular on a complete blood count, which we just talked about with you. If we see that there are signs of a bacterial inflammatory process in the blood, if the SOI is high, if the C-reactive protein indicator is also a bacterial inflammatory process, it is above normal, then in such a case we no longer doubt, but prescribe an antibiotic. In any case, you as parents should not take responsibility for prescribing antibiotics. Listen to the doctor, follow the prescription, do as the doctor says. But if you really see that there seems to be no indication for an antibiotic and they prescribe it to you, just ask the doctor again why he thinks an antibiotic is needed, if there are any indications, and if your doctor convinces you, then definitely take the antibiotic. And if the doctor tells you, well, maybe it's better to take it and isn't so sure, then just consult another specialist. Listen to the opinion of another specialist. And if the two opinions coincide, then accordingly follow the prescription. If the opinion of the second doctor differs from the opinion of the first doctor, then here you will, of course, have to choose which doctor to listen to. But I wish your children health. I wish you correct and competent prescriptions. I wish you to avoid sinusitis. See you.